Hello, everybody, and welcome to today's webinar where we're going to be analyzing the new AMA codes, parity effects, and the ONC Data Brief results. My name is Michael Dillon, and I am the Director of Marketing here at Mend. I'm going to be your host for today's webinar. And today I have the privilege of joining Matt McBride, the President and Co-founder of Mend. Matt, how are you doing today?
Michael, doing fantastic. Should be another great webinar for everybody. So I'm looking forward to it.
Ditto, same here. I just want to say a quick legal disclaimer before we begin. This presentation does not constitute legal advice, so please consult your legal counsel, compliance, and/or billing resources. The new AMA telehealth codes are a big deal because they could create an opportunity for lesser payments. So we're going to review the new codes and then discuss potential impacts on payment parity. In other news, the ONC Telehealth Data Brief was recently published, so we're going to cover those insights as well. Then, as a special bonus, we have an update to provide on the DEA proposed telehealth prescribing rules. And then finally, we're going to round out today's webinar with a Q&A session. Starting now, you can use the Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end of the webinar. So let's get started. The percentage of physicians utilizing telemedicine surged to nearly 90% in 2021. Matt, what were the primary tools being used to conduct those visits?
Yeah, and I think there's one important thing that is worth mentioning before we really dive into all of the material today. I don't know if folks saw it, maybe you saw it in the news, Yahoo Finance or some other sources, but Mend recently just celebrated its 10 millionth telehealth appointment on the platform. So yeah, we had Michael is pointing to his shirt there. We kind of celebrated that within the company. We had shirts and other swag made for everybody. So we're really proud of that we're able to kind of participate in helping many of you, or maybe we'll help some of you attending to help people through virtual care. So sorry for the side note there, but to get into our first slide of the presentation, I think, obviously not surprising here with the graph, we saw a huge jump in virtual appointments throughout the pandemic, where, physicians were saying 15% of physicians said that they were doing some sort of telehealth prior to the pandemic, and then we see this big jump to, almost every physician was reporting that they did some kind of telehealth. So, not too surprising there. But what was interesting in the data that was published, the government is a little bit behind the curve, and that they're just publishing a 2021 study, but there's still insights to be gained from this, which is why we wanted to cover it before we get into some of the other material. What was really interesting is that you have 58% of visits were done on a telephone, and then 49% of visits done using a video. Now, why doesn't that equal 100% precisely? Well, I think as many of you are aware, the government, because of the public health emergency, allowed telephone to be used. And then there's been further policy that's come out to allow folks to elect to use audio only in certain cases if they don't want to use a video platform or don't have access to a video platform. But as a provider, you have to have both. Per what the regulations say. So the reason it doesn't exactly equal 100% is because many folks were doing both. They were doing there was a good percentage of people that were probably doing some video visits, and a good percentage that were also doing phone visits. So that's why it doesn't quite add up to 100%. But wanted to call this out for what we're going to cover later on in the presentation, that telephone was used quite a bit, and what is that going to look like in the future? We're going to get into that a little bit later in the presentation.
So it's important to healthcare organizations, professionals, and our government that quality of care be maintained for telehealth and versus in person. So Matt, what do the ONC report say about the quality of care?
Yeah, so most physicians reported that quality of care was just as good as in person. I mean, 90% reported that. And I think, there are probably, I'm sure there's going to be some cases we see this from our customers that, not everything is safe to be done in telehealth, and maybe there's something else going on. Maybe it's a little bit more emergent. And so maybe you have to refer somebody to some type of in-person visit, whether that be at your organization or maybe something a little more urgent is happening. Maybe you've got to refer them somewhere else. So I think, with the fear and all the unknowns of the pandemic, we saw about 90%. I think for the average healthcare organization that's constantly offering telehealth visits and has a protocol and is able to triage and direct patients accordingly, I'm sure almost 100% of their visits would be the same quality of care as an in-person visit. But I think the other sort of notable data point in the study around utilization was that while we saw a big jump in almost every provider using telehealth, whether that be telephone or video or some combination of the two, we also, about 25% of the total volume was being done virtually, whether that be through video or audio. So there was still a lot of in-person activity happening. Now, if you're a behavioral health organization, that is probably 80-90% is virtual, and you may still be at 80-90% virtual. So obviously there's going to be a lot of variation from organization to organization, but some good stats and insights to be learned here.
Yeah. So in-person visits and telehealth visits have their pros and cons like anything else. Matt, what did the ONC report highlight in terms of technology struggles? And then also, if you can talk about no-shows in relation to telehealth versus in-person visits as well there, that'd be great.
Yeah, a couple things to point out from the study, and then there's some new developments happening as well around technology barriers that we wanted to report out on in the presentation today. I think everybody, any organization, has seen some sort of patient struggle, and that was identified in the report. And then providers were able to identify some of their struggles as well. And again, this was new. This was, everybody's just racing to maybe stand up a solution. Some groups that we were helping were just trying to stay in business. So this was, new for a lot of people. So I think to see people struggle with something that's brand new, is to be expected. And hopefully a lot of organizations have seen those kinks work themselves out. But I think there's a couple things to sort of note here on the patient side and provider side. First, on the patient side, I think having a platform that is frictionless, right? You get a link, you click it, date of birth, you can connect on any device. So really just eliminating any of those friction points are definitely going to help. Using a service like Mend that also offers, instant technical support that's US based in case anybody is struggling. And then we're going to talk about maybe some, just a couple things you can do proactively in a couple slides here. But on the provider side, I think, it's really important to note that, if a provider does have any issues on their side, that could affect every visit. So while you might think and you might pay for a great internet, that doesn't necessarily mean that, the modem that's providing you the service that hasn't been restarted in 2 years is providing exactly what it needs to provide. So for the provider side, you want to make sure that, you're proactive and you have the ability to monitor those things. And we provide a lot of reporting around that for our customers, and also have a proactive team that will reach out to providers if we're seeing any anomalies in their connectivity. So just some important things to note. And, while technology does not, work 100% of the time, and we've all experienced those struggles, it's important to look at some other data around these types of visits. And Michael, you talked about, you asked about the no-show rate. And so while, there could be the occasional technology hurdle from time to time, what is the no-show rate compared to those, compared to in-person visits? And so we'll touch on that in the next slide. But just one important new development to report on is that CMS is going to require Medicare Advantage organizations to help their members with digital literacy. So to provide training, to provide assistance so that those folks can use telehealth services. So we do see the government, not only is the government been doing a lot of work around increasing broadband access and has been investing a lot in that, but now we're seeing CMS also put some pressure on the Medicare Advantage organizations. And I think that there'll probably be some funding and other things along those lines for this, but a pretty new development within the last month that the government is going to require some digital health literacy programs to help folks as well.
So Matt, you touched on the no-show rate like we just spoke about in the previous slide. This is probably an important pain point for many in the audience today. So you can provide a little bit more detail there, like you mentioned?
Yeah, I mean, whether it was before the pandemic, during the pandemic, or today, I think one of the top problems that organizations are looking to solve with a virtual program and maybe other forms of patient engagement is to bring down that no-show rate. And so, across the US, when you're looking at, 1 in 4 patients may not show up that you put on the schedule. And, you're probably not going to have any technology issues with an in-person visit unless, somebody has trouble with their car maybe, but those folks can come in and show up and there aren't really any technological barriers. But what does your no-show rate look like for in-person visits? Is it something close to the national average here? Where on the telehealth side, you could have, maybe you have the occasional person who does have an issue, but across our entire platform, we see a 7.4% no-show rate. So more visits happen, even though, somebody might have the occasional technical glitch. So there is still an opportunity for folks to help more people and, divert certain visits where appropriate and where safe to telehealth to realize some of the benefits that convenience can bring to an organization.
So Mend is a platform that works on very low bandwidth connections, but some small percentage of people can still struggle. So what is Mend doing to be more proactive for customers and patients?
Yeah, so we do have some reporting that's available, and we won't make this a big Mend infomercial, but we've got a lot of other really good content coming up here. But we just thought it would be worth mentioning that we do have some reports that can identify who might have issues in advance of an appointment. And so we make these reports available to our customers, and we look at all sorts of different things. Has the person had a telehealth visit before? Have they tested? Do we have the ability to communicate with them? Sometimes we get appointments sent to our system and there's no email or phone number. So how do you even call that person, right? Let alone maybe send them a link and do a video connection. So these are the things that are available to, just kind of further cut down on the ability to, to sort of reduce some of the technical issues and, really help keep no-show rates as low as possible for organizations that we work with.
So finally, what were the key feelings expressed by the physicians in this ONC report?
Yeah, so kind of last slide here on the ONC report before we move on to some other things, but still, even with some of the challenges, still the sentiment is strong. I think a lot of physicians saw maybe there's some ability to do some hybrid work to save on some travel time. So, there's conveniences all around. There's a win for patients, a win for physicians, a win for healthcare organizations here. So it seems like most people were still pretty bullish on telehealth as an offering. And then I think another important call out is, not every organization gave physicians a tool to use. So maybe they, just kind of relied on people to use something that they had themselves, FaceTime, maybe use their own phone to make calls. And really what we see here is that there's a much higher satisfaction rate among physicians when their healthcare organization equipped them with a platform. Right. So I think that is a really important call out, especially considering some of the staffing issues that healthcare organizations have gone with, some of the sort of the recruiting and retention issues that healthcare organizations have seen around staff and physicians, so on and so forth. So there's a much higher satisfaction rate when physicians have a platform provided by their healthcare organization.
Awesome. So it is time for an audience poll question. So in preparation for the next segment of our presentation, we want to ask the following question. I'm going to go ahead and launch that now. And so the question is, what is the percentage of your telehealth visits that are audio only across your organization? And so there's 4 choices: 0 to 25%, 26 to 50%, 51 to 75, and 76 to 100%. So you guys should see that poll question appearing now. We'll give everybody about a minute to answer. And then once I'm done, I'll share the results with Matt and we can continue the webinar. Looks like there's a whole bunch of answers coming in now. So this is great participation so far. Matt, I want to share you some of the results that we got. It looks like it's slowing down, about 10 seconds left if you still want to get your answer in there. But 77% of the people said only 0 to 25% were audio only across the organization.
Yeah, I think that does kind of match what the study said. The study said of all the appointments, 25% were telehealth. And then of that 25%, about 60%, or maybe about like a total of 16, 17, 18% of total visits would be audio only. So I think that does kind of align well with what we saw in the ONC study. However, there's developments that we're going to start to get into in the next section here that can, that might put some of that at risk that everybody needs to be aware of. So more to come on that in just a few slides.
Yeah, certainly. Let me stop sharing this. Let's get back to the webinar. I think skip one there. Oh, no, there we go. So Matt, this was pretty big news, but maybe not in the good way, like you said. Can you explain a little bit more of this to the audience today?
Yeah, so we, we just kind of briefly touched on this in some of our earlier webinars this year as we heard that this was a possibility from the AMA. So I'm sure most of you know the AMA has, copyrights on all the CPT codes, and they have this panel that modifies the CPT codes that get used for billing insurance claims. And what we saw was, and this has been published now, so there are 17 new telemedicine specific office visit codes. And so part of the concern there is, for years and years, most organizations use the same E&M codes, so they were using a code that they would use for in-person visits, and then just add a modifier, or the place of service would change, and that's kind of changed over the years. But now we have telemedicine codes that are aligning with office visits, and there's not a lot of detail. If you pull the summary from the AMA, there's not a lot of detail around these codes. You know, if it's a 5-minute code, a 15-minute, or if there's a complexity to it, there's not a lot of detail that I saw yet around the codes. Only that they were potentially, it seems like there's potential for these to replace the way that telemedicine has been traditionally billed. These codes are supposed to become effective in January 2025. And really the reason why this is important is, does this create an opportunity to pay less for a telemedicine visit? And so I think that's the key piece to pay attention to. And we've still got plenty of time, right? The remainder of 2023, all of 2024. So this is going to be something important to watch out for and really stay up to date on. And we're going to talk about maybe some other ways to get involved and address this as well.
Yeah. So Matt, let's help the audience understand the risk a little bit better here. So we have new telehealth codes being created. So can you provide a little bit more context specifically about that?
Yeah, so payment parity has always been a topic around telehealth. So basically being paid an equivalent rate or the same rate for the same services, right? So, if somebody shows up to your office with a condition, or if you're helping somebody through telehealth with the same exact condition, you're doing the same work. You have to staff that care. You have to document that care. You may be audited on that care. All these types of things. I think, physicians have really felt that they should be paid equivalent, for the same services. And so you have pretty much every state has passed some sort of payment parity rule. Most of this was done before the pandemic, and most of these laws actually don't have any teeth at all in them. So your, state laws are unlikely to provide any type of protection to your organization here. But at the federal level, we've never seen payment parity legislation. And even if we do, would there actually be any teeth to it? We of course saw this on more of a temporary basis for the public health emergency, but what is the future going to look like here? So the door has been open with these new codes. And so definitely this is something to pay close attention to.
Great. And I just want to, please use the Q&A if you have any questions. I saw some people raising their hands. So, we're going to get to all of that at the end. But Matt, I want to get back to, you had covered audio only usage during the pandemic for telehealth earlier. Is the government sunsetting audio only?
Yeah, I mean, if you bill these 3 codes on this slide, they are marked to be deleted in 2025. So I'm not sure if that means that the government is going to rely on modifiers now, and that's why they're sunsetting these codes. We don't exactly know all the answers yet, because some of this is going to be open to interpretation by CMS as they put guidance out there, and they'll put guidance out there that's open for comment. So we may have to watch for those comments, and everybody might have to get involved in those comments for some of the updates that they put out, or sort of end of year physician fee schedule updates that they put out. But these three codes are marked deleted, so they're being deleted. You know, we have that sort of angle to this. And so these codes, you know, you have one is for 5 to 10 minutes, 11 to 20 minutes, 21 to 30 minutes. Now for audio only, that has been approved specifically for mental health moving forward, that is being billed with a modifier. So maybe, you know, that's not going to go away. That's law of the land. So mental health for audio only is going to remain, but other organizations, you know, what is going to happen to telephone visits moving forward here? We're the future is uncertain at the moment.
So we're talking about changes going into effect in 2025, which is a while from now. So what can organizations do to be proactive about it?
Yeah, I mean, we've always recommended this, but one key way is to, you know, just have everything be contracted with your payers. And you know, this might be a little bit easier said than done. It might be a little bit of an oversimplification, but if you look at history prior to the pandemic, all of these states, they passed payment parity laws. They don't have any teeth. Why don't they have any teeth? Because health insurance organizations, payers, kind of took some of the teeth out of the legislation. Why did they do that? They wanted to have the flexibility to set rates in their contracts, right? One particular organization maybe has, you know, tremendous outcomes and they want to pay more. Maybe another organization is smaller, they want to pay less, whatever the case may be, right? That's typically what we've seen in the industry. So not only that, we saw organizations where state law was not great, was terrible for telehealth in their state, but they worked with their payers and they contracted equivalent rates, and they proceeded to offer telehealth to those folks in those states, even when the laws were terrible. So this is a great way to just get everything in black and white for your organization. So just sort of negotiating that payment parity with your payers is going to be a key defensive tactic here. And then, you know, we'll talk about sort of the offensive tactics here on the next slide.
Yeah, so clearly there's time to react to the proposed changes, but so what else do you recommend?
Yes, I mean, we're going to touch on it, but I'm sure most people saw that the DEA proposed changes for telehealth prescribing. A lot of voices spoke. Those voices were heard, and the DEA is back to the drawing board. So now more than ever, as these things are developing, it's important to be heard and get your voice out there. So we already talked about watching out for the physician fee schedule and the comment periods for that. CMS may have some other materials that are out for comment just because of how fluid and dynamic everything is right now with the end of the public health emergency. You just sort of staying up to date, attending webinars like these, so on and so forth, but then also getting involved through different trade associations that you belong to, whether that be, the AMA, the AHA, the ATA, there's probably several that your organization belongs to. A lot of those organizations are going to accumulate insights from all of their members, draft letters, and send those letters out. There's other types of associations you can get involved in, like the App Association, which is actonline.org. This is a big group. They follow all of the digital health trends and host meetings and prepare letters and make comments. There's other organizations like that. Also contacting your local representatives so that they know where their community stands on these issues. So it's going to be really important to continue to be heard and stay involved. And as the government is trying to shape what the future is going to look like for virtual care.
So this is obviously a huge topic we've been tracking and reporting on. What's the latest update on this DEA proposed rule that you can tell us?
Yeah, so great job to anybody that's on the call that got involved. It was a record-breaking number of comments, over 38,000 public comments. And I know, patients were involved. We were signing on the letters. There were people that hand delivered their comments to the DEA and sent the DEA right back to the drawing board. So what they've done is they've come out with a 6-month extension. So basically, they have between now and November 11th to try to get to something final. So I would imagine, probably within the next couple months here, we'll see something new proposed that maybe we'll have an opportunity for comment again, or maybe it'll be something a little bit closer to final, but definitely stay tuned to that. We're trying to get some information from the Hill, and we're working on another event. So maybe an event in the next couple of months, we'll have a little bit more insight here on maybe what's likely to happen. But I know this was something that could have really made things challenging for all of us as patients, all of us that are in the industry providing care. And this is why we're saying it's important to be heard, because some of these new developments that are happening that open the door for maybe the elimination of audio only or to be paid less, these are things we need to pay attention to, and we need to continue to speak and be heard. And ultimately, I think the government is just trying to figure out what works for patients, what works for healthcare organizations, what works for kind of everybody involved. And so we've got to continue to shout and be heard and let the government know so that they can craft the right way forward for us all.
Yeah, definitely. Before we get to the Q&A portion of today's event, our audience may or may not already know that Mend is a complete patient engagement platform for in-person, for virtual, or any type of visit. Matt, can you explain this a little bit more detail for the audience?
Yeah, it's clear even in the ONC data, we're not doing 100% of appointments virtually. And, there probably, there are some organizations that do, but, for the majority of healthcare, most organizations are going to have some combination of virtual and in person. And Mend is really a complete patient engagement platform built from the ground up for hybrid care. So, doing phone visits, doing video visits, in-person visits. Maybe you have providers going to see patients if you have the social workers or other types of providers like that. Maybe you have operations in schools and you need kiosk mode. All of those features and functions we have built in our platform to be able to help patients schedule, make changes to the schedule, be reminded of their appointments, complete their forms electronically, make payments. We can host the visit, so we can make it frictionless for patients and providers to connect through audio, video, and we provide all the features, functions around that. And then we can assist with anything after the visit, following up to get survey results, collecting payments, or a host of other things that can be done as well. So definitely feel free to check that out if that's something that you're interested in learning more about.
Yeah, and if you're looking for more informative content, we have a library in the resource section on the Mend website. And this is actually where you can find the on-demand version of this webinar, or and our February webinar as well, of how the omnibus bill impacted the 2023 telehealth policy, where we discussed other impacts of the end of the public health emergency on telehealth policy. We actually have a whole blog series about these changes as well. And we're going to send a direct webinar recording link to everyone that registered for today's webinar. But you can also check out a lot of other great resources there that are relevant to this topic, among other things. So simply navigate to mend.com, click on the resources section in the nav bar. Today's webinar has been amazing, but before we jump into the Q&A, I want to give the audience the opportunity to let you know that if you want to schedule a personalized demo of Mend, you can also just go to mend.com/demo. And with that, Matt, let's jump to the questions. As a reminder to our audience, the Zoom Q&A option is in the toolbar. Make it easier for us to get to all your questions. So let's jump right in here. First off, Ethan, actually, there's a couple of people that asked the same question of when we will see a final rule from the DEA on telehealth.
Yeah, so still a little bit unknown right now. The deadline appears to be November 11th. So we'll likely see something before that, maybe the ability to comment again. But if they still don't have it right, I mean, people could get loud again and maybe there'll be another extension. So a little bit up in the air. And I know some organizations that offer a lot of telehealth, whether it's the majority of your visits or 100% of your visits, there's some potential risks there given just what they proposed. And if you want more details on that, we went into a great depth of what was proposed, and that is available in an on-demand webinar in the resources section that Michael mentioned. But as soon as we do see another proposal, we'll host an event. And as I mentioned before, we are trying to work with contacts that we have on Capitol Hill, trying to understand maybe which direction it's going to go, and trying to put that in some future events here over the next couple months.
Great. And two people asked this. I touched on this briefly about the copy of the recording and the presentation deck. Yes, we will get that out to everybody that registered after the webinar today. So let me jump to the next question here from Boyd. How important is it for telemedicine platforms to integrate with EHRs, and why?
Yeah, and there's a little bit more to that question, so I was just kind of reading the
Yeah, I
whole
want to give
question
you
as
an
well.
opportunity to do one at a time, but yeah, if you want to go for the whole thing, sure.
Yeah, we can break it up. I think now that I read it, that makes sense. So, yeah, I mean, we have customers on both sides, customers that are, have integrated, customers that, have non-integrated workflows. We support both. So, for example, you might want to have all of your patients and virtual appointments syncing from your EHR to a platform like Mend. We can handle all the reminders. We send the links. We encourage folks to test. We provide all the technical support. So, that can be a good option. We also have organizations and workflows that want to have more of a waiting room. They want to have just one link for their organization or one link for their provider, and they want to just include that link in a reminder system that they already have, and everybody just kind of shows up to the same place. Maybe they put that link on their website, billboards, what have you. So we have those types of workflows as well. I think what we saw in the ONC data was really around physician satisfaction. And there wasn't necessarily a higher satisfaction rate among physicians, of integrated versus not. So I think as long as they have access to a platform, that was the key data point from that study. So we support both workflows. Both workflows can work well. So I think it's really just a matter of, what do you think would work best for your organization, and kind of how do your providers want it set up? How do you want to operationalize it?
Okay. And Boyd, if that doesn't answer your question fully, feel free to contact us after. We're more than happy to dive more into those details. Pamela asked, do you have any more information, updates on e-consults?
Yeah, so I saw that question. Pamela, you might have to clarify a little bit exactly what you mean on an e-consult. I'm not sure if you're maybe talking about some of the digital check-in codes or something else. So feel free to just, if you can put a little bit more detail in the Q&A, or feel free to email me as well, matt@mend.com, and I'll make sure I get you an answer. But I'm not exactly sure how to answer that one.
All right, we'll jump over to Alex. Had a question about our ideal prospect client, and was wondering if our focus has been on opening new specialties or moving people away from other platforms, or what is Mend focused on? I'm assuming I'm getting that right, Alex. Please let us know and re-ask if I'm off on that.
Yeah, I mean, our average customer, is a medium to large size organization that really wants to, install an enterprise grade telemedicine solution and sort of have all of the bells and whistles that are needed to do that, whether that be doing video visits. Maybe you want to have a kiosk mode in certain situations. You want to have forms and consents and payments and all of these different pieces that go along with that. So we definitely skew more towards medium to larger size organizations. We definitely have concentrations of certain specialties that really lean into virtual care, like behavioral health is an example. But we have over 90 different specialties, and we have customers in every state. So there's definitely an opportunity to potentially help your organization. So hopefully that answers Alex's question.
Awesome. Thanks, Matt. I got one final question from Ava. is thank you for the helpful information you shared today, Matt, but wanted to know if there's any other CPT code changes that they should be aware of.
Yes, there are other changes more specifically related to some of the category 1, 2, and 3 telehealth codes. So I think a lot of codes are still being evaluated by CMS, as there are codes that it's already been proven that telehealth offers the same quality of care. Then there's codes that they're pretty sure, and they're still going through the data and still collecting data and learning that telehealth is going to be viable to treat patients for those types of codes. And then you have other codes that are a little bit more experimental, temporary. So some of those maybe they're unlikely to become permanent. So if you just sort of look up, if you look up anything related to CMS and their category 1, 2, 3 telehealth codes, you'll see some of the other codes that where you might still see some shuffling around, might see them removed from telehealth, or you might see them bumped up and sort of made more permanent for telehealth.
Awesome. Thank you for that. Pamela, actually, before we jump to the next slide, she clarified her question a little bit more. So I want to bounce this off you. She wanted to know if it will be allowed, an example of providers communicating with each other via EMR only.
Yeah, so provider to provider communications. I haven't seen anything that that is going away. So I wouldn't hold me to it, because I haven't really researched that area in great detail. But I can say that I haven't really seen anything in all of the changes that I have been tracking. I haven't really seen anything that is going to change. So I think some of the provider to provider communications are still going to remain. I could be wrong. Just to put a disclaimer on that, I could be wrong. But I haven't seen it in all the areas that I've been tracking.
Awesome. I want to thank everybody for getting those questions in. And then, also thank you for tuning in today, everybody, and joining myself, Matt McBride. It was an honor discussing all of this with you, Matt, and we hope all of you guys tune in for our next one, and we will see you soon and make sure we get all this material out to you shortly. So thanks again.
Thanks, everybody. Have a great day.